Hey, everybody, welcome back to the Energy MD podcast, where we help you resolve your chronic fatigue syndrome, and long COVID so you can get back to living your best life. So, as you know, we talk a lot about the toxic five as being the root causes for all of these conditions. And that's a combination of heavy metals, chemicals, molds, infections, and nervous system dysfunction. So, one of the things that we do talk about quite a bit are dental issues and oral health issues, and we've got the expert with us today. So Jonathan Landsman, just have to say Landsman, but I know it's Landsman. Let's learn a little bit about Jonathan. So for over 35 years, Jonathan has been in the health and fitness industry and is the creator of Natural Health 365programs.com, one of the most popular natural health websites in the world. Throughout his career on the internet, Jonathan has created over 500 online programs with over 300 of the brightest minds in the natural health and science. He is the creator of many online educational programs, including the Holistic Oral Health Summit and Stop Cancer Docu-Class. To learn more about what Jonathan's doing these days, visit naturalhealth365programs.com. Jonathan, thank you so much for joining me today.
It's great to be with you, Evan. It's clearly something you've covered before, but my feeling is that people are going to learn something brand new today, as I have, even though I've been covering this topic for years. There is no doubt a lot of people need to hear this message, and it's not covered enough. So thank you for all your efforts.
Yeah, I'm really excited too, excited to learn from you, and I absolutely agree. There is going to be a lot of really great nuggets in this podcast episode today. So, let's go ahead and kind of let's get started with oral health in terms of if you can maybe set the stage for us in terms of like what ideal or what does normal look like when it comes to oral health, and then we can talk about dysfunction.
Well, I mean, I don't know if we want to start off with normal, but I think I understand what you mean. Normal for a lot of people is unfortunately part of a very big problem, Evan, and that is people are afraid of their dentist. And I might say it's justified because dentistry, by and large, again, with a lot of respect that I have for dentists that I've worked with nearly 40 years in health and fitness industry, dentists in particular have actually come to me with all kinds of health problems,
Mhm.
neck pain, back issues, stress in general, not exercising. There's a lot of reasons why they've come to me for health coaching for nearly my entire career in the health and fitness industry. So I have a lot of respect for them. But by and large, whether they're aware of it or not, the fact is that conventional dentistry is hurting millions and millions of people every day. So
Mhm.
I think normal for a lot of people is they're one, afraid of going to the dentist because they have hurt them. And it is a painful experience, nothing enriching about it at all, nothing empowering at all about it. For a lot of people, they hear just about everywhere, Evan. They don't need to come to your podcast to understand, it's a good idea to brush your teeth and to floss. But then normal is go onto the internet with all kinds of toothache problems. Or what should I do about root canal treated teeth? What should I do about fluoride? Are mercury based silver fillings okay or not? And if you go to the internet, most of what they're getting there are really, at the very least, I'm going to be nice about it, misinformation. And at the worst, it really is flat out lying to people. Because I say that now at this point, Evan, all these years later now, the conventional dental industry, they've been sort of pushing a certain narrative that mercury-based silver fillings are fine, root canal treated teeth are perfectly okay, there's nothing to worry about. Fluoride is perfectly safe. It's a great way to prevent cavities and make your teeth all nice and healthy and strong. They go on about all of this, and they'll even claim that it's based on science, really good science, when in fact the opposite is true. None of that is true, what I just said. All of these things are very toxic and harmful to people. So people go around now not really knowing what to do until there's an emergency. And then the common thing, as you had started off this podcast with, the common thing is to go to a conventionally trained dentist and there's tooth pain, drill and fill. If that's a problem still, well, then let's do a root canal treated tooth. We'll fix that up and we'll quote unquote save the tooth. And that's the best thing to do. And it's not at all. Nobody is being explained what the problems are. We can break down each one of them if you like, but know this for sure. Most people are being deceived every day. And at the very least, they're very misinformed. And I would say, especially those people listening to your podcast, Evan, a lot of people that I talk to on a daily basis, beyond the average person that might run into me on the street or in a supermarket, gas station, whatever. But most of the people that run into me and recognize me at health food stores or in supermarkets, wherever I might go throughout the country and visit places, they're going to say they're really into natural health. And then right away, they'll talk about a health issue they have, fatigue being a big one, stress, of course, all kinds of immune related issues. They tell me their whole health history. And then I'll ask those people who are very into natural health, have you looked at gum pocket size? Do you work with a biological dentist? And the whole thing ends up being back to what I said at the beginning. Oh, no, 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 no. Jonathan, you're talking about dentistry. I'm afraid of going to the dentist. The
Mhm.
last time I went, he really hurt me.
Mhm.
And I see that this is a huge ignored slashed overlooked slash misinformed group of people who are very into health, not dealing with poor oral health issues. So common is not so good looking out there. And I think we all have to step up our game every day because this is so much more important, our oral health, way more important than most people consider, especially those people who are suffering with health problems right now.
Yeah, a lot of people don't realize how much of a problem their dental health can be when it comes to their fatigue. There's three things or three things that can happen when I can't get somebody better in my programs. One is that they have a nervous system dysfunction that they're not willing or able to work on. Two is that they're living in a moldy environment and not able to get out. And three is that they have a dental cavitation or an infection or some sort of hidden something that's happening in their mouth that is draining their energy, causing inflammation that has to be remedied. So I appreciate you saying that. And it's such a challenge today with the as you said the dental industry and this relationship that we kind of have to dentists. And so then I guess let's go to what kind of dentist should people be looking for?
Well, there's no doubt they should be looking for a biological or, in a simple term, a holistically minded dentist, a dentist that understands that, look, their job is to explain to you why you might be having, where you may be having, what you may be having, and why you may be having these dental issues, poor oral health issues, and how that is related to what you also may be talking about in your health history when you first go to that office. I have fatigue. I have autoimmune issues. I have mold sensitivity. The different things that you mentioned also, Evan, all of these things. The problem is so many people are focused on their health issues, like Lyme disease, or all these odd things. Why am I bringing up all these different things that have no relationship on the surface to each other? Because our immune system has to be strong. The healthier and the stronger we are, the more resilient we are to some mold exposure. Now, don't get me wrong, you got to correct mold issues if you have them. That's a whole big deal in and of itself. Or if you have chemical sensitivity issues, of course, if you're exposed to a lot of chemicals or you're eating really bad diet, you have to fix those things. But again, going back to who we're speaking to mostly, who listen to your podcast, Evan, I would venture to say that most of the people listening are doing a lot for their health, but yet they still suffer. The underlying issue is not getting with a good biological dentist. You can find that dentist by doing a search. I suggest personally the International Academy of Oral Medicine and Toxicology, IAOMT.org.com. It'll get you to that website. You can do a search. There's 1,500 plus dentists. There's always more and more dentists looking to come on board, be a part of this organization, learn from the leaders in the field who are teaching these dentists. Look, there's a better way for you to take care of those people. But I'm going to just jump in and say, for many years, Evan, I've been telling people, oh, go to IAOMT.org.com, the International Academy of Oral Medicine and Toxicology. Go there and search for a dentist that's close to you. You may have to travel some distance, but just do that. And I usually stop right there. But I'm really going to emphasize that in this day and age, with all the years of experience that I have, please still be careful, like anything else you would do. Not all of them are created equal.
Mm-hmm.
And I would say a big difference would be, can they give you a 3D X-ray, cone beam X-ray, which will really show up a lot that could be hidden in the mouth, even if you go to most of the dentists throughout the world. If they don't do that, they're not going to know, and they're not going to be able to tell you. So does that dentist have that? Now, granted, it's $100,000 unit plus, who knows, give or take a few dollars. So if they don't have it, do they work with a dentist that does do that exam and give their results to that dentist? Or is that dentist that you're going to that may have given a thumbs up from IAOMT.org? Okay, I found one that I like. Are they able to read the results of that X-ray? That's what I would say is the first thing to do. And the bottom line is not to feel stressed out. Ask questions. Many times, even myself, Evan, I've caught myself being okay with answers that I didn't like. And this is why, as I get older and older, I say follow your gut intuition. If you don't like the way you're being handled right away at the beginning, looking for a dental office, you don't like the way they're answering you, or should I even say, not answering your questions, just stop right there. Go to another dentist. Don't even bother. And you have to go by that, because 99 out of 100 times, you would have been right. And the last thing you want to do when it comes to your healthcare is just say, well, doesn't really matter that much. Maybe it was no big deal. I'll just go to this one. It seems like the easiest one. And then months later, you say to yourself, I never liked that person. I shouldn't have gone. And something really bad happened to you. So for sure, I would say look up on that website, find a dentist or many of them that may be in your area. You may have to travel, make phone calls, and you're going to be able to tell if you like an office or not. There's a big difference out there, and you can tell from the moment they pick up the phone.
Yeah, I'm glad you mentioned that. And we're going to get into some of the specifics in a moment, but you want to find somebody who has a fluoride-free office, who has a mercury-free office, right? And then also has that cone beam CT, and then potentially also has a fragrance-free office. That's kind of what I tell people to look for as well. Do you agree with that? Is there anything else you'd add to that list?
Yeah, I mean, I guess that's good that you said it for beginners out there. But yes, I'm smiling because if that's not in the office, if something other than what you just said is happening, they aren't holistically minded. If what do you think about fluoride? If you walk into the office, because you won't know that on a phone call, I mean, maybe you feel a little uncomfortable saying to use air fresheners in your bathroom or something like that. But when you go to the office for that first visit, maybe you want to, if it's close enough, visit the office, a surprise visit, and just walk in. That would be super. Go into the bathroom, check out what they're doing in the bathroom. Is it Clorox bleach and all kinds of chemicalized cleaners that are sitting under the sink and all of the things that you mentioned, and air fresheners are in there. And, so when I go to a holistic dentist, we're talking about there was a Berkey water filter in the waiting room. Now, I'm not saying they have to have that, but the point was that was the signal. They have
Hmm.
these little prayer glasses, these big glass buckets, for example, where you can put in a prayer for yourself or someone that you love. They're just thinking of the whole person, right? They have essential oils that they spray to keep the air fresh and smells nice and cleaner. So you really get an indication from the demeanor of the people there. How do the people seem that are visiting, the patients? Look at how they seem when they're walking in or walking out, checking out. There's a lot you can find out in probably about 5 or 10 minutes that will give you insight whether the person is really a holistic dentist or not. So that's my long answer to saying yes, Evan. Great recommendations. But again, go by your intelligence, your intuition. You're going to know if someone is good for you or not, if they're explaining things. When you go to the office, we might want to just add on now, go for a cleaning. Let's say you go for a consultation. They may charge a few $100s at most. That's another thing. If they're charging you $1,500, $2,000 to go visit them for their first appointment, that is not an impossibility. But if that's happening, find another dentist. That is, they're overcharging you for that. So let's say at the most it's a few $100s. Come in as a new patient, and then you get your teeth cleaned. Do the teeth cleaning and wait all the way to the end. Now, this is a big, good test. They go in, they scrape, they polish, they do whatever, right? They talk to you about, oh, you have a little plaque here or there, whatever they might say to you. Wait till they're just about all done and even confirm at the end. Is that it? Are we done? And let's, of course, say they say yes. If at that whole time after they've now said they're done, they have never checked your gum pockets. And even if you bring it up now that I brought it out to your attention and you say something to them, oh, yes, 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 we did. I did check them. They're fine. But even still, if they did not tell you what your gum pocket sizes were during the hygienist doing their cleaning of your mouth, if they didn't tell you what those numbers were and that they were going to do it, I would say to you, find another office. I mean, don't get me wrong. It's nothing to panic. Oh my God, what happened? This is terrible. What it did to me. But that's a great indication of an office that isn't well trained, not super clear, not educational oriented. And that's a huge issue because when we're talking about being chronically fatigued from sleeping all night, eating organic food, exercising, meditating, doing all these things, and oral health is an issue, and you're not being spoken to by that dentist about what your gum pocket size is, Evan, at this point, that's negligence, plain and simple. It doesn't take much to take a little probe. Obviously, they're not going to use a pen, but they use a little thin little probe and they'll go into the gum line to see how much of your separation of your gum to your tooth. And you want to hear numbers like 1, 2, 3. That's okay. 4, 5, 6, and beyond. And every time you go, you don't want to see that number going up and up. But my point is, that is absolutely a great way of testing. Is this office rock solid or not? And the ones that aren't telling you pocket size, I'm telling you now, they're on shaky ground. They may have good intentions, but that's not what you're looking for. I'm speaking directly to those people who really don't feel well and they want the best in dental care. You need to know what your pocket size is, and you shouldn't be begging your dental office to do that for you. It should be an automatic thing in a really good dental office.
So what does knowing your pocket size do for you?
Good question. The larger your pocket size, let's say it's a 4 or 5, and of course, as you go for every quarter, Especially again, if you're not feeling well every 6 months or even if you went every year. If you hear that that number keeps going up and up, that means the gum pockets are getting bigger and bigger. That means when you're chewing and whatever's left there and the plaque and infections that may be brewing, again, going back to understanding whether you have hidden undetected infections or not, best is to get that 3D x-ray. But with larger gum pocket sizes, that's not good. That's going to allow infections to get in to the rest of your body. And I mean, you're talking about saliva mixing and getting into your digestive system, your blood becoming contaminated. And this spills into everything else that every person out there listening to your podcast, Evan, would be most concerned about. I don't want to feel tired anymore. I don't want these cancer cells rapidly dividing in my body. I want my immune system to be more robust. I want to be able to sleep better at night. I don't want to feel so anxious. You mentioned nervous system issues in the past, just at the beginning of this podcast. So, all of this is related to having big gum pocket sizes where the infections get in and stress out the rest of your body. And of course, heavy metals that might be in your mouth. And we can talk a little bit more about that as well. But bottom line is, you want that gum tissue to be really tight up against the tooth itself, the bone. And that's really the healthiest.
And some of these specifics that we're going to right now are part of this larger picture, which you kind of alluded to, which is so much of health is influenced by the oral cavity. Yeah.
100%. Yes. As I said before, the reason why I bring it up the way I do whenever somebody's talking to me about this issue is because I find day in and day out, Evan, everybody's talking about their leaky gut, their digestion is no good, their fatigue, as I've mentioned a couple times already, all of these cheap health complaints. And they go on to tell me they've gone, and again, most of the people I'm speaking to are savvy people. Oh, I've gone to this naturopath, I've gone to this medical doctor. He's holistic. But then when the discussion becomes more about their mouth, oh, it becomes a very nerve-wracking, tense type situation, which I, of course, never want to have anyone feel. But I mean, it's always the same kind of reaction 99.9% of the time. Something I don't want to talk about. It scares me. It worries me. I've had a bad experience. I don't have anyone. Or just a glazed over look like, huh, I didn't know anything about that. And so most people, even in the natural health world, don't know that what's happening in the mouth as a gateway to your digestive system, how you're going to absorb nutrition, has everything to do with how healthy your mouth is. If your mouth is toxic with heavy metals, mercury-based silver fillings are in there, lead, nickel, whatever might be sitting inside any of your teeth, if not many of them, gum disease, infections in your mouth, if any of that is going on, you're stressing your digestive system out, you're polluting it, you're polluting your bloodstream, and you're putting tremendous stress on your immune system. In fact, if we take it all the way to the cancer clinics of the world that are taking care of, God forbid anyone's diagnosed with cancer, the best holistic ones are saying, look, before we do anything else, we have to clean up your mouth and make sure that is rock solid. And then, yes, of course, we have to take a final look at how you're eating. Are you eating too many sugars, which could be feeding poor oral health and the rest of your body? Are you exposed to too many chemicals? Maybe we need to take better quality supplements, and this is how much, and this is what we have to take. All of those things are great. Sound therapy, light therapy, far infrared sauna, exercising, meditation, lots of different things that people will get into. But if the assault is happening day in and day out, as Hal Huggins, a pioneering, amazing man of blessed memory, who was a biological dentist many years ago, I was one of the last people to interview him before he passed away. He said, you have to turn off the faucet before you get out of the shower, right? You can't just stand in the shower, I'm wet, and keep drying yourself with a dry towel, and you don't turn off the faucet. That's a great analogy for, not turning off the faucet of all the toxins going into your body. Correct the problems in your mouth. And then, yes, all these other things you'll do will actually be enhanced. You'll have a greater chance of having all those things help you so much at a faster rate if the mouth gets cleaned up first. And that, in many cases, Evan, you do need a dentist. You cannot do this alone. That's just the
Mhm.
bottom line. Somebody that you're comfortable with.
Mhm. So let's go to the cone beam CT. So why is that helpful? And I mean, I require it for people going through my program so that we know for sure that that's not a problem.
Well, that's great. I mean, there's bite wing x-rays. So everybody knows about, chomp down and hold a little film on one side or the other. That's fine. It's okay. You can see certain things that any dentist can see, but doesn't give you the whole picture. And I would say, my personal experience, Evan, this is something I've gone through recently that has blown me away. We have not enough time to go into it, but in short, a panoramic X-ray, which is two-dimensional, which seems like, oh wow, you get such a nice picture, still doesn't show what a 3D X-ray where you can spin the head around, not your head, but the image of your head after the 3D X-ray is taken. You can spin it around at all different angles and see under and around and through like no other x-ray. A lot of infections are there hidden if you just go by bite wing or panoramic x-rays. And in short, Evan, what I was referring to a moment ago, I was told, and it was really bothering me, let's just put it that way, for about 2+ years at least. Jonathan, by a top, and of course I'm not going to name who it is, a top biological dentist. You have two cavitations, upper right, upper left. You got to take care of it. It's on your treatment plan. Let me know when you're ready to go. I'm sure you have it. We've got to go in. And that's off of a panoramic. I happen to move. So down here in Florida, I moved from one place to the other, a few hours away. And so, Evan, of course, I got to find somebody else. And I go through the whole process of what I explained before. Let me check them out. I know so much about biological dentistry. Let me see who I can find. And long story short, I found somebody who had a 3D x ray machine. And I never had one of those done. Long story short, had it done. Excellent machine, brand new, state of the art facility, beautiful. The guy is super clear, black and white, no fluff to this guy at all. A surgeon, okay, all day long, he sees people for all this kind of stuff, pulling teeth, extracting, and taking care of cavitations, all this stuff, cutting in and taking care of this stuff all day long. He looks at this afterwards on his own computer software program, takes a mouse, goes onto the screen, shows me the bone density, which you can get with these 3D x-rays, and the bone density was rock solid. He went into my upper sinus area, which has no bone density at all, shows me the numbers in extreme negative. He shows me a very high, nice positive number, lots of strong bone, all in the upper right, all in the upper left. And he looks at me, matter of fact, and says, Jonathan, you don't have cavitations here at all. This is over 2 years on my mind that I have to get this done. He's got to cut into my gum. He's got to dig in and dig out all this infection that's in there that I'm feeling fine. And mind you, a lot of people with cavitations could have no symptoms at all. So it was bothering me. But this 3D x-ray really does show everything. And a lot of dentists are just not up to speed with it. And it's been out for a while, but still, there's a lot of offices that don't have it. And I just strongly encourage people to go to a place that has it to at least get that done. Because even in my wife's situation, she had women's intuition on her side. She knew something was wrong, but none of that was detected with a biological dentist we went to that did not have a 3D x ray. When we went to this new one and he did the same thing for her, He found what was going on there. And thank God he got hers in the upper mouth before it breached into the sinus cavity. It becomes a much more serious problem. And people are walking around with this, Evan, millions of people feeling completely fine, okay, doing all the healthy stuff that they're doing, and they are infected. And I want to just add one other thing that's very important. Why is this such a big deal? Because maybe you move and there's a little bit of mold. Maybe, God forbid, you lose your job. Maybe, God forbid, somebody dies. Bottom line is, stress goes way up in your life, and you were fine before, but there was a brewing infection taxing your immune system every day. And then what happens is that extra new thing pushes you over the edge, and people tend to blame that thing that happens. And granted, it may be a big thing that causes illness in somebody. But the point is for us to be as resilient as possible. And that means cutting down the stress in our life as much as we can so that we can handle very stressful, unexpected things that may come up in our life. These smoldering, significant infections in the mouth should be taken care of as soon as possible. Unfortunately, prevention is not a very sexy word, and undetected infections, it's a tough thing to tell somebody about because, ow, they're not screaming in pain. But it's a serious problem. And if it's dealt with sooner, person is a lot better off.
I agree. And so getting the cone beam CT or 3D X-ray, as you refer to it, is going to help people identify cavitations, which are basically infections in the jaw. Is this all correct?
That would
And
be correct. And of course, these infections in and around the gum tissue that when you take a 2D X-ray, Evan, countless times, my own personal experience, and so many people that I'm talking to now, oh, you're fine. Biological dentists, holistic, high level dentists, right? Who are saying, you're okay.
Mhm.
You're okay, or there is a problem without really knowing. And that's the problem with all the other x rays. And my point is, we have the technology now. It's an open and shut case. Get it done to get an accurate evaluation in black and white so that this can be taken off your table of whether it's something you need to deal with or not, any kind of infections going on anywhere in your mouth.
I couldn't agree more. And so how does it compare with a dental thermogram?
Well, thermography is, again, not as clear at all. 3D X-rays, these cone beam X-rays are the test based on, I'll put it simply, many top biological dentists who I trust now, and I've had extensive conversations about this topic. This is exactly what I'm talking to people about all the time, anywhere I go now. This is the one that needs to be done, not just heat, not just red or yellow. We're talking about the actual 3D X-rays that must be taken now for people, and it is well worth it.
Mhm. So how do people get cavitations or these hidden infections?
For the most part, it's from pulling, extracting a wisdom tooth. That's a lot of people are affected with that because there's a lot of people that had that done. But extracting any kind of tooth, wisdom tooth, or another kind of tooth in the mouth, even extracting it properly, not just improperly, it is possible for this to happen where a bone infection just occurs. And again, that's over time, Evan, and there isn't anything that exact about the science. Why does Bob and Sally, I mean, they live this way and that way, and they went, I'm just making up a story, but it's very common to what you hear. They went and got a 3D X ray and they're fine. How come I do all of these things? I do so much more than they do, and I am infected. How did this happen? How did I get this cavitation? It's everybody's biochemistry. How much stress are they under? Did they have too much sugar in their diet? Even if compared to somebody else, it's less. Are they not sleeping well? Is their immune system down just a bit? Are their genetics in such a way that it just caused this infection to occur? But the bottom line is, Evan, we could go into all the storytelling about why and all these long explanations as to why one person may be sick or not. If you find it on a 3D x-ray, you've got to get it fixed by a good surgeon that can go in there and is comfortable doing this on a daily basis. I would add that a lot of holistic dentists, they may be nice and you love them, but they don't have a lot of experience doing surgery, especially cavitation work. So it's very important that you establish that with the person that you're with. Do you do this? Do you do it often? Oh, no, I refer it out. I mean, and it's not that that's bad in and of itself, but I just want people to be aware of the fact that a holistic dentist still has their strengths and their weaknesses, right? So you
Mhm.
just really need to understand what is your situation and then match it up with a dentist that seems right for your particular issues that you're having.
Mhm. What about root canals? How do they relate to chronic fatigue and other illnesses?
Again, it's the same idea of anything that could be chronically stressing you out every minute of the day, right? Chronic fatigue, there's inflammation going on in the body, whether it's mental, emotional stress, not sleeping well, poor diet, all these things. But a root canal treated tooth, once they go in, this is the only place in medicine where they say, it's okay. There's a dead body part that's going to be in your body. They're going to clean out that nerve. They're going to sever it. It's going to be a tooth basically that does not circulate as well as a normal functioning tooth that you have in your body. And so now you have an environment where infections can brew, the bacteria can harbor in there and grow and then spill into the rest of the body. So a root canal treated tooth is not what you read on the internet. Just a great way if you have a cavity, they drill and fill, you still have pain, just go back to the dentist, get that root canal treated tooth, get that procedure done, and everything will be a-okay. In fact, the best part is you get to save your tooth. That tooth is severely compromised, and in time, all of these teeth, I'm going to repeat, all of them are infected. How much does that affect an individual? Anyone dealing with fatigue every day and health problems, if they're telling me they have a root canal treated tooth, I'm going to advise that person to go get it taken care of. Now, there's a lot of different ways to do that. Pulling it out, depending on the age of the person, obviously, and cleaning it out well and using ozone, making sure that area is as clean as possible. That would be step one. Depending on the age of the person, where the tooth is located. No, lots of people don't want to walk around, especially if they're younger, with a space that they can see, that people can see. So filling that up with either a fake tooth, there's bridges, there's all kinds of, or an implant that may have to be done as well. Obviously, ceramic is the way to go, not a metal titanium. Do not get a titanium implant. Do not get a titanium implant. Make sure you get a ceramic implant. So these are all things that you need to talk about with a biological dentist to talk about your options. But again, it'll depend on where the tooth is, your age, your health status. But there is no doubt, Evan, if someone is suffering with health issues, as I know you already know, and you talk to the people who work with you closely, you've got to get that out.
And there's also some research on root canals, cavitations, and cancer, right?
Yeah, without a doubt. I mean, again, it goes back to the distraction. And I know that may seem like a mild term, but it's a real term every single minute that I think anyone with cancer would raise their hand and say, yeah, I don't want to see that happening, a distraction of the immune system. So if that's happening, and you're stressed out with gum disease or a fully infected root canal treated tooth that is causing all kinds of problems throughout the rest of your body, then your body's immune system is having to deal with this constant stress to the immune system instead of focusing on recognizing where are cancer cells, getting those natural killer cells involved into play, neutralizing those cancer cells and getting rid of them, right? And obviously, getting rid of any toxicity requires that we have a healthy digestive system. This is a fundamental, basic fact. So when we have mercury-based silver fillings in our mouth, we have gum disease, we have cavitations. This is compromising the integrity of our entire body. And just on a tissue level alone, that should be a red alert. If there's tissue compromise here, you're red, you're bleeding, you're infected, you're inflamed here in the mouth, obviously the rest of your body is dealing with that as well. And that leads to cellular dysfunction, digestive breakdown, and then everything else is a mess, which makes it difficult for you to deal with something as catastrophic as cancer. You want to have all your pistons firing as strong as possible, if I can use a race car analogy. And again, it just starts with making sure your house is clean so that you can now be clear about the next thing to go after, to just keep supporting yourself as much as you can so you can beat those cancer cells literally out of your body, which is what we're designed to do if we're feeling healthy and strong.
Mm-hmm. I remember seeing charts of the meridians that flow through the mouth and the relationship between the infection, the root canal, the cavitation, and it's on that same meridian as the cancer that somebody had. That was definitely very interesting to see.
100%, because now you're just going into, we are energy beings. And I'm sure
Mhm.
most of the people that listen to your podcast, they get that. Our electrical energy, our cellular energy, all of our energy has to be really high. And yes, they can look at a chart. Anybody can go to the internet and look for these dental charts, these meridian
Mhm.
charts. And depending on what number tooth you have, there are energy pathways that run through the rest of our body, and they do affect each tooth, does correlate to breast, lungs, digestive system, stomach, kidneys, and nervous system. The list goes on and on. So if there's a problematic area in the mouth with a given tooth that energetically is compromising you in another part of your body away from your tooth. So this is, again, when you said about cancer before, cancer does not thrive. No disease really thrives in a highly energetic, on a cellular level, a highly energetic body where everything's moving so quickly, so smoothly. Our nervous system is great. We don't have impingements in our spine. Everything's firing off great. We don't have any infections that we're dealing with. When we eat food, our nutrition, our nutrients are getting in the cells. Our waste products are getting out efficiently, and life is smooth. We mentally, emotionally, and physically feel great, right? But the bottom line is, if there's problems in the mouth, those energy systems are immediately compromised. And that's when there's a breakdown. And how many times, Evan, have you and I both heard, I don't get it. I take these supplements, I do all these things, and I'm not getting my head above water.
Mhm.
I'm not feeling better. It's because the energy systems are down. So, what on earth is taxing you? Is it emotional? Is it mental? But is it a physical thing that we're spending a lot of time talking about today? And that being poor oral health issues.
Mhm. So when a dentist recommends a root canal to a patient, besides running in the opposite direction, the patient should probably say to the dentist, "Can we just pull it instead?" Is that what you would recommend?
That's a loaded question because again, it depends on the dentist who you're talking to. But are you saying that if the person does not have a root canal treated tooth already in that area, that it's an infection? Is that what you're asking me?
Correct.
And what are they saying to the patient exactly?
So the dentist is saying, okay, you have this issue with your tooth, and the way to remedy it is to get a root canal. How should the patient respond? Should they say, actually, let's just pull it instead?
Well, again, that would sort of be my second choice.
Okay.
I know you said not to say this, Evan, but I would tend to run for the hills, actually. But if the dentist is just saying that to you, and again, all due respect, Evan, the way you made it sound is kind of like it's a willy-nilly thing. Again, right? Back to what I said early on in this podcast. Are they educating you? Are they speaking to you about anything else? Or is it just bada bing, bada boom, if I can use a Brooklyn expression, right? But if it's that quick and willy-nilly, the way they're saying it to you, Evan, my first choice would be leave and find another dentist that you can talk to about this. Because yes, you would want to look into pulling that tooth. I know it's stressful for people to hear that, but then you also have a lot of other conversations that have to take place. Depending on how bad it is, it might be even saved with ozone treatments.
Mhm.
You may be able to do that before even having to consider something else. So that's my point. If a dentist hasn't even talked to you about that as a possibility, depending on how fully infected your mouth is in and around that tooth, again, Evan, that's a red flag. Okay. So I
Mhm.
hope that answers your question. I know people are still going to want to just a black and white answer, but the point is, it shouldn't just be something that you quickly decide upon. And a dentist should be able to talk to you about many different options, even if they pull your tooth. What happens after that? And if they're not really capable of doing that, you're in the wrong office.
Yeah. And I think it's important for people to know. So ozone that we're talking about here, this is not IV ozone. This is injectable ozone. This is ozone that's being injected into the gum, which has antimicrobial properties and oftentimes can help out with any sort of infection that's happening.
Yes, it gives you a good indication about the solidness of the office. Liquid ozone, water with ozone in it that they're using to spray in and around. You might even have to rinse before you get started. I know I'm being
Mhm.
a little nitpicky there, but that's pretty cool if they're giving you that. And gas. Yes, the gas that they're infusing that's getting in and around and penetrating everything, biofilm included. It will dismantle everything that may be wanting to hide that is no good for you in terms of an infection. So, yeah, ozone gas is really great as well. So, you're right. And of course, getting IV ozone treatments, that's a whole other story, not at the dental office, but that might be something that somebody wants to look into if they've got these systemic infections. But in the dental office, for sure, that may be something that could save the tooth and you don't have to consider pulling it. But otherwise, if they say pull it, better be able to explore all the options with that dentist.
Mhm. And that's another thing that you can put on that list when you call up to ask and see whether or not the dentist is a good fit for you, is to ask whether or not they do ozone. So
100%.
So two more things. I want to talk about fluoride before we go, and then also mercury fillings. And hopefully we can do that in the next 9 minutes. So fluoride, tell us why fluoride's bad for us.
Fluoride is toxic. A chemical that is not, this substance is not required at all. This is a total lie from the conventional dental industry for decades and decades and decades that this will somehow keep your teeth healthy and strong. It is not something you want in your body at all. And it's just think of it as a waste product. So it is very simple. It shouldn't be in mouthwash. It shouldn't be in your baby water. I mean, it's crazy that I have to even say this, but I find that there are products to this day that have all of this. It shouldn't be in your mouthwashes. Herbal rinses are fine. Essential oils are great. There's just no place for fluoride at all in anyone's diet or treatment plan. This is very toxic for the body.
Yeah, agreed. And tell us about mercury. Why is mercury a problem?
Mercury is very neurotoxic. I mean, literally, Boyd Haley, people can look up the great body of work from Dr. Boyd Haley, who's an amazing expert on mercury, talked a lot about the dangers of mercury. Mercury-based silver fillings are over half of it is with mercury. So this heavy metal is neurotoxic. And he would show film a long time ago. It's an old film, but you can see the video. It's really scary stuff. And it's amazing. It's just black and white. As soon as that mercury gets close to your nerve endings, boom, the nerve ending, it would just be decimated. It would completely disappear, vanish from into thin air. So this stuff is really dangerous to have in your body. It causes massive amounts of inflammation throughout the body, digestive problems as well. It gets within the cell and it stops nutrition from getting into the cell because now it's sort of taking up its space inside those cells. So this is something that you definitely don't want to have in your mouth at all. I personally had them in my mouth for 30 plus years. It was horrible. 14 of them all throughout my upper and lower teeth. Shallow fillings, thank God. One of the single best things I ever did for my health years and years ago was to have them all removed. But you do have to be careful when extracting them because in drilling them out, the vapors can get out. And if the dental office is not set up well, you have a world of hurt ahead of you in terms of being exposed to so much more mercury. But even if you don't go to the dental office to have anything done with them, just walking around with them every day, chewing, drinking, conventional dental sites, they're not going to talk at all about this for the most part. But it's true. That mercury that's in those fillings, in that tooth of yours, is leaking out mercury all the time. And think about it. It's close to your brain. It's mixing with your saliva. It's going down into your gut. This is poisoning you every single day. And people with anxiety, nervous system issues, digestive issues, or any kind of serious health problems, heart disease, cancer, autoimmune disorders, all of these things, you definitely want to get rid of these mercury-based silver fillings as soon as possible. They just have to be taken out properly. Good ventilation in the room, good suction around the mouth. There's a lot of steps. The International Academy of Oral Medicine and Toxicology, they have a step-by-step plan that really safeguards the dentist, the hygienist, or the assistant in that procedure, and of course you. They'll protect you from harm. So a lot of things to be done to minimize the risk.
Mm-hmm. Excellent. So, Jonathan, you have a free gift for our listeners, the Holistic Oral Health Summit. Right? Can you tell us a little bit about that?
Sure. I mean, if you go to just go to holisticoralhealthsummit.com, you enter your name and email address there, and you can get the program and watch. We dive really deeply into all these topics, much more detail, and you get on our newsletter list that way for our Natural Health 365 programs. But holisticoralhealthsummit.com is one of my many programs that I've created, which really addresses all the things that we've talked about. You get that program, you're going to have a lot of great information before you select the dentist that really is best for you.
Wonderful. And we'll drop that link below along with the naturalhealth365programs.com.
Great. Thank you. And yes, of course, if they enter their name and email address, they'll get access to the program. It's no cost at all. Of course, if they want to purchase it afterwards, that's great. But they will get access to viewing all the programs, all the presentations that I did. So thank you, Evan.
Thank you. And thank you so much for coming on today. I know I learned a bunch from you, and I hope that everybody listening did as well. So thank you so much. So if you have chronic fatigue or long COVID, come check us out at energymdmethod.com and jump on a free fatigue clarity call where I will review your history and help you figure out what you're missing and why you haven't been able to get better yet. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only. and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.